Question number 1. What equipment is commonly used to monitor fetal heart rate during labor? The correct answer is option A, cardiotocograph, CTG. Question number 2. Which stage of labor involves complete cervical dilation? The correct answer is option B, first stage. Question number 3. When should the nurse prepare the delivery tray in the labor room? The correct answer is option D, when the mother is in the second stage. Question number 4. Who maintains a partograph during labor observation? The correct answer is option A, nurse or midwife. Question number 5. What instrument is used to clamp the umbilical cord after delivery? The correct answer is option B, cord clamp. Question number 6. Which stage of labor ends with the expulsion of the placenta? The correct answer is option C, third stage. Question number 7. What is the normal duration of the second stage of labor in a primigravida woman? The correct answer is option B, 30 minutes to 1 hour. Question number 8. When is an episiotomy usually performed? The correct answer is option A, during crowing of the baby's head. Question number 9. Which instrument is used for suctioning a mucus from a newborn airway? The correct answer is option B, mucus sucker. Question number 10. What fluid is used for cleaning the perineal area before delivery? The correct answer is option C, iodine solution. Question number 11. Which position is commonly used for vaginal delivery? The correct answer is option A, lithotomy position. Question number 12. When should the newborn's first cry be assessed? The correct answer is option A, immediately after birth. Question number 13. What is the normal color of amniotic fluid? The correct answer is option A, clear or pale straw color. Question number 14. Which hormone is responsible for uterine contraction during labor? The correct answer is option C, oxytocin. Question number 15. What is the nurse's first action after the baby is born? The correct answer is option B, ensure the airway is clear. Question number 16. Which instrument is used for suturing an episiotomy wound? The correct answer is option A, needle holder. Question number 17. What should be checked in the placenta after delivery? The correct answer is option A, number of lobes and completeness. Question number 18. When should the nurse record the APGAR score of a newborn? The correct answer is option A, at 1 and 5 minutes after birth. Question number 19. Which complication is most common immediately after delivery? The correct answer is option A, postpartum hemorrhage. Question number 20. What is the nurse's duty during the fourth stage of labor? The correct answer is option A, observe for uterine contraction and bleeding. Question number 21. What instrument is used to check cervical dilation during labor? The correct answer is option A, gloved fingers. Question number 22. Which observation indicates the onset of true labor? The correct answer is option B, regular uterine contraction with cervical changes. Question number 23. When should the nurse assess the fetal heart rate during active labor? The correct answer is option A, every 15 to 30 minutes. Question number 24. Which membrane surrounds the fetus and amniotic fluid? The correct answer is option C, amnion. Question number 25. What is the primary purpose of conducting upper vaginal PV examination? The correct answer is option B, to assess cervical dilation and effacement. Question number 26. Who should be present in the labor room during high-risk delivery? The correct answer is option A, obstetrician, pediatrician, and nurse. Question number 27. What is the ideal temperature to maintain in the labor room for our newborn? The correct answer is option B, 25 to 28 degrees centigrade. Question number 28. Which part of the fetus is delivered first in a normal vertex presentation? The correct answer is option B, head. Question number 29. What term describes the expulsion of the fetus and placenta from the uterus? The correct answer is option C, labor. Question number 30. Which document is used to record the progress of labor? The correct answer is option D, photograph. Question number 31. What action should be taken if meconium stained fluid is observed? The correct answer is option B, prepare for immediate neonatal resuscitation. Question number 32. Which sign confirms complete placental separation? The correct answer is option B, lengthening of the cord and gush of blood. Question number 33. What is the most important nursing responsibility during the second stage of labor? The correct answer is option B, support mother's pushing efforts. Question number 34. When should the nurse start perineal cleaning after delivery? The correct answer is option C, after the placenta is delivered. Question number 35. Which item should be ready for immediate newborn care after birth? The correct answer is option C, warm towels. Question number 36. What is the normal blood loss during vaginal delivery? The correct answer is option D, 300 to 500 milliliter. Question number 37. What stage of labor begins with the delivery of the baby and ends with the delivery of the placenta? The correct answer is option B, third stage. Question number 38. Who administers the oxytocin injection after delivery to prevent bleeding? The correct answer is option C, nurse or midwife. Question number 39. What equipments help in maintaining warmth for a newborn in the labor room? The correct answer is option B, radiant warmer. Question number 40. Which observation after delivery indicates uterine contraction is adequate? The correct answer is option A, uterus is firm and centrally located. Question number 41. What action should the nurse take when the fetal heart rate drops suddenly during labor? The correct answer is option A, increase maternal oxygen and notify the physician. Question number 42. Which factor mainly determines the duration of the first stage of labor? The correct answer is option B, parity of the women. Question number 43. When should the partograph recording be started during labor? The correct answer is option A, at 4 cm cervical dilation. Question number 44. Who should clamp and cut the umbilical cord after delivery in a hospital setup? The correct answer is option B, trained midwife or nurse. Question number 45. What is the first sign of placental separation? The correct answer is option D, all of the above. Question number 46. Which position is recommended for the mother during the second stage of labor? The correct answer is option B, semi-recumbent or lithotomy. Question number 47. What should the nurse observe in the newborn immediately after birth? The correct answer is option A, color, cry and movement. Question number 48. When should the first dose of oxytocin be given after delivery? The correct answer is option B, before delivery of the placenta. Question number 49. Which instrument is used to clamp the umbilical cord? The correct answer is option B, artery forceps. Question number 50. What is the most important purpose of AHPRA scoring? The correct answer is option A, to evaluate the newborn's adaptation to life. Question number 51. When should the placenta be examined after expulsion? The correct answer is option A, immediately after expulsion. Question number 52. Who should verify the completeness of the placenta after delivery? The correct answer is option A, delivering nurse or midwife. Question number 53. What should be checked in the perineum after delivery? The correct answer is option A, for tears or lacerations. Question number 54. When is the third stage of labor considered complete? The correct answer is option A, after expulsion of the placenta and membranes. Question number 55. Which fluid should be readily available for IV use during delivery? The correct answer is option A, normal saline or Ringer's lactate. Question number 56. What should the nurse do if excessive bleeding occurs after delivery? The correct answer is option A, massage the uterus and inform the doctor. Question number 57. Which position helps in preventing postpartum hemorrhage? The correct answer is option B, lateral position. Question number 58. When should the newborn's weight be recorded? The correct answer is option A, immediately after birth. Question number 59. What should be done with the instrument after delivery? The correct answer is option A, wash and sterilize them properly. Question number 60. Which observation indicates that the uterus is contracting properly after delivery? The correct answer is option A, uterus feels firm and centrally located. Question number 61. What is the main purpose of uterine massage after delivery? The correct answer is option A, to prevent postpartum hemorrhage. Question number 62. Which sign indicates the beginning of labor? The correct answer is option A, lengthening and increased vaginal discharge. Question number 63. When should the nurse provide emotional support during labor? The correct answer is option B, throughout all stages of labor. Question number 64. Who is responsible for monitoring maternal vital sign during labor? The correct answer is option B, nurse or midwife. Question number 65. What is the normal heart rate of a newborn? The correct answer is option B, 100 to 160 beats per minute. Question number 66. Which instrument is used for perform an episiotomy? The correct answer is option A, scalpel. Question number 67. When should a nurse encourage the mother to push during the second stage of the labor? The correct answer is option A, during uterine contraction. Question number 68. What is the first step in neonatal resuscitation? The correct answer is option A, clear airway and dry the baby. Question number 69. Which maternal complication requires immediate intervention in the labor room? The correct answer is option A, postpartum hemorrhage. Question number 70. What is the purpose of fundal massage after birth? The correct answer is option A, to stimulate uterine contraction and reduce bleeding. Question number 71. Who is responsible for whipping the newborn? The correct answer is option A, pediatric nurse. Question number 72. Which observation indicates fetal distress during labor? The correct answer is option A, meconium-stained amniotic fluid. Question number 73. What should be done if a mother experiences excessive uterine bleeding? The correct answer is option A, massage the uterus and notify physician. Question number 74. When should the nurse start perineal care after delivery? The correct answer is option B, immediately after placenta delivery. Question number 75. Which equipment is essential for neonatal resuscitation? The correct answer is option A, suction apparatus and big mask. Question number 76. What is the recommended duration of the third stage of labor in a normal delivery? The correct answer is option C, 5 to 30 minutes. Question number 77. Who should monitor maternal urinary output during labor? The correct answer is option B, nurse or midwife. Question number 78. Which position helps improve fetal oxygenation during labor? The correct answer is option A, left lateral position. Question number 79. What should be observed in the placenta after expulsion? The correct answer is option A, completeness and absence of retained membranes. Question number 80. When should the AHPRA score be assessed in a newborn? The correct answer is option A, at 1 and 5 minutes after birth. Question number 81. What is the normal range of maternal blood pressure during labor? The correct answer is option B, 90 over 60 to 120 over 80 mmHg. Question number 82. Which sign indicates the onset of the second stage of labor? The correct answer is option A, complete cervical dilation. Question number 83. When should the nurse assist the mother with breathing technique during labor? The correct answer is option A, during contraction and the second stage. Question number 84. Who is responsible for monitoring the fetal heart rate during labor? The correct answer is option B, nurse or midwife. Question number 86. What should the nurse do if meconium-stained amniotic fluid is observed? The correct answer is option A, prepare for immediate neonatal resuscitation. Question number 86. Which part of the newborn should be dried first? The correct answer is option C, head and face. Question number 87. When should the nurse encourage early breastfeeding? The correct answer is option B, within the first hour after birth. Question number 88. What is the main purpose of applying eye prophylaxis to the newborn? The correct answer is option D, to prevent ophthalmia neonatorum. Question number 89. Which observation indicates maternal dehydration during labor? The correct answer is option B, dry mucous membrane and low urine output. Question number 90. What should the nurse check in the perineum after an episiotomy? The correct answer is option D, for bleeding or infection. Question number 91. Who should assess uterine tone after delivery? The correct answer is option B, nurse or midwife. Question number 92. What is the primary indication for using a partograph? The correct answer is option A, to monitor the progress of labor. Question number 93. Which vital sign is most important to monitor in postpartum hemorrhage? The correct answer is option B, blood pressure and pulse. Question number 94. When should the nurse administer vitamin K to the newborn? The correct answer is option B, within the first hour after birth. Question number 95. Which sign indicates normal urination after delivery? The correct answer is option A, clear urine with good volume. Question number 96. What is the purpose of keeping the newborn under a radiant warmer? The correct answer is option C, to maintain body temperature. Question number 97. Which observation indicates retained placenta? The correct answer is option B, continuous bleeding with soft fundus. Question number 98. When should the nurse clean the newborn's eyes after birth? The correct answer is option B, immediately after birth. Question number 99. What should be observed in the newborn skin immediately after birth? The correct answer is option B, color, rashes and bruises. Question number 100. Which intervention help prevent hypothermia in the newborn? The correct answer is option D, skin to skin contact with the mother.